Hi everyone, my name is Jamie Costello. I am a graduate student in the Master of Public Health program at the University of New England. This community health assessment was performed on St. Johnsville, New York as part of a community assessment class. Thank you for inviting me to share my findings. St. Johnsville is a small rural community at the western end of Montgomery County, New York. Because of its location in the county, St. Johnsville is fairly geographically isolated and is not targeted with many community-specific public health efforts. There are 2,631 residents living in the town of St. Johnsville. The majority of those residents live in the village on the south end of town. The majority of St. Johnsville is Caucasian. Few residents do self-identify as African American, Hispanic, and/or Native American. The median age of St. Johnsville residents is 41.9 years old. However, you'll see that nearly half of the population consists of children under the age of 18, as well as aging adults ages 62 and up. Keep in mind that children and aging adults are two populations that are often at risk for a number of health issues. The goals of this assessment, as well as any community assessment, is often threefold. The primary goal typically is to identify community health issues and contributing factors to those concerns. A community assessment can also begin to introduce public health concepts to the community, as well as can be used as a tool to increase community partnerships surrounding public health issues and a host of other topics. The Mobilizing for Action Through Planning and Partnerships, or MAP framework, was chosen as a logic model to guide this assessment for the main reason that it was designed to be a tool for assessing community health while bringing the community together and involving everyone in the process. Additionally, the MAP framework consists of 4 assessments: community themes and strengths, local public health systems, forces of change, and community health status. Together, these 4 assessments allowed us to use epidemiological data, but also to look at the entire system of a community in relation to public health issues. To start our assessment, let's take a look at some of the socioeconomic factors that can affect an individual as well as the public health. In St. Johnsville, only 83.5% of the population have obtained a high school degree or higher. The median household income in St. Johnsville is far below the national average at a mere $36,700. 26.5% of the population lives below the poverty level, and these numbers rise when we're talking about children as well as aging adults, those two at-risk populations. 17% of the housing units in St. Johnsville are vacant, which greatly affects the community identity. And while average rent and mortgage payments are fairly low, nearly 40% of households are using over a third of their gross monthly income on expenses such as mortgage and rent. This can greatly affect their ability to pay for health care and healthy foods and things like that. A windshield survey showed that while there are a number of retail and convenience outlets in the village, there's a lack of support services, and there's only one small grocery store within the community. In addition, 13% of households do not have access to a vehicle, even further limiting their ability to access support services outside of the community. Data analysis of all the quantitative and qualitative data collected as part of this assessment through using the logic model, the MAP framework, as well as a windshield survey and a number of key informant interviews, brought about 5 health concerns and priorities in St. Johnsville: preventable hospitalizations, premature death, nutrition, access to care, and mental health and substance abuse. Let's take a brief overview of each of these issues. The age-adjusted preventable hospitalization rate per 10,000 people over the age of 18 years old in St. Johnsville is greater than 147.3. Now you'll see that this rate is far above the average rates in Montgomery County and New York State, as well as the New York State Department of Health's 2018 Prevention Agenda goal. The primary causes for hospitalizations include short and long-term effects of diabetes and heart attacks. The rates of premature death in Montgomery County as a whole are also higher than elsewhere in the state and the nation. The main reason for premature death in the county is cancer, followed by heart disease, accidents or unintentional injuries, chronic lower respiratory diseases, and diabetes. Keep an eye on diabetes and heart disease as we keep going through some of this information. These 2 chronic conditions are related to a number of other items that were identified through the assessment. Nutrition in Montgomery County is also of great concern. While only 2% of those living in New York State have limited access to healthy foods, 19 of those living in Montgomery County have difficulty accessing healthy foods. Additionally, 13% of those living in the county have experienced the lack of reliable food source at some point in the last 12 months. Nutrition plays an important role in maintaining good health and preventing diet-related chronic diseases such as obesity, diabetes, and cardiovascular disease. For those in need of medical care, there are a few resources within St. Johnsville. The community is home to an optometrist, a physical therapy office, one primary care clinic, and one urgent care center. Due to low access to care in their own community, many residents have to seek medical care elsewhere within the county. However, you'll see that even Montgomery County as a whole has low access to care. Primary health care providers, mental health providers, and dentists all have higher patient-to-physician ratios than elsewhere in New York State. While specific data was unavailable for St. Johnsville community regarding a number of these issues, as well as mental health and substance abuse, information was available for Montgomery County as a whole. 14.6% of those living in Montgomery County have self-identified as having poor mental health for more than 2 weeks in the last month. In addition, the binge drinking and smoking rates among adults are higher in Montgomery County than elsewhere in New York State. A number of key informants listed suicide as a concern in St. Johnsville. Data show that the age-adjusted suicide death per 100,000 people is 12.5 in Montgomery County, as compared to 7.9 in New York State. The Prevention Agenda 2018 goal is even lower at 5.9 per 100,000. Clearly, work needs to be done in this area as well. After these health concerns were identified and prioritized using a number of criteria, lack of access to healthy foods was identified as the top priority health issue to be addressed in St. Johnsville. Given that 13% of the population has experienced food insecurity in the last 12 months and nearly 20% of the population in St. Johnsville has limited access to healthy foods, these are issues that affect a large proportion of the population. In addition to having a high prevalence in St. Johnsville and Montgomery County, lack of access to healthy foods can have grave economic costs due to its connection to diet-related diseases such as heart disease and stroke, diabetes, and obesity. In addition, the social cost of this issue is pure social injustice. As quoted by As It Stop and Joy, access to healthy food is a right, not a privilege, to be enjoyed by a few. Now, there are a number of risk factors associated with limited access to healthy foods, all of which are highly prevalent in St. Johnsville among its residents. Low income is one of the greatest risk factors for this issue. In St. Johnsville, 14% of those aged 65 and older live at or below the 200% poverty level, and 39.4% of those under the age of 18 live at or below the 200% poverty level. Now, you'll notice that those are priority populations. We have those 65 older, and we have those under the age of 18. And within those priority populations, as those identified priority populations, we have high rates of low income in those households. In addition, transportation is another risk factor. 30% of households in St. Johnsville do not have access to a vehicle. So if they can't get to the small local grocery store in town or can't get what they need there, they're going to have to go elsewhere, and that's not always possible for those living in St. Johnsville. The environment is another risk factor for those with low access to healthy food. There's only one small grocery store in the village, and many local food options offer only unhealthy and expensive options. Larger grocery stores are nearly 10 miles away in each direction, west and east. For this reason, St. Johnsville is considered a food desert because food is not readily accessible in a rural area within 10 miles. That makes it what we call a food desert. Lastly, the issue of access to healthy foods has a high potential for prevention. There are a number of programs currently established to tackle this issue in St. Johnsville, including assistance programs such as WIC and SNAP, as well as the food pantry and backpack programs through the local school. Potential future strategies could include increasing the variety of foods available in the community, increasing the number of farmers markets available in the community, offer nutrition and meal planning education, promote the food assistance programs that do exist, and introduce non-commercial agriculture, such as community gardens and things like that for the community residents to really get involved in. Now, with all of this, collaboration is the key to making all of these possible, but there's a very high level or potential for prevention for the issue of lack of access to healthy foods. In review, a number of health issues were identified in St. Johnsville, New York through this community health assessment. However, a lack of access to healthy foods was identified as the top priority issue because it is a social justice issue. It's a highly prevalent issue associated with high social and economic costs, and there are a number of risk factors limiting access to food, all of which are, again, highly prevalent within the St. Johnsville community. And finally, there's a high level of potential for prevention regarding this issue. So it's something that the community can change if they band together. It is necessary to note that due to the small size of St. Johnsville, there was a lack of community-specific data found for many of these issues. A good portion of the data used in the assessment was at the county level. To confirm the information that was found at the county level, we did a number of key stakeholder interviews as well as performed a windshield survey assessment. It is recommended that the next step for the St. Johnsville community is to gather additional data via focus groups and surveys at the local level to evaluate the data contained in this assessment. In addition, it will be important to increase community participation in current nutrition programs and further assessments, as well as in designing solutions to address health concerns. The vital piece is that this is all done together as a community for the community. As stated by Estefania Guadalupe Estrada, alone we can accomplish many great things. Together we can change the world.